you have really nice boobs. Can I touch them? It's like, no, you cannot.
Hi guys, if you're joining me for the first time, my name is Yeti Alamide Adeburn, and if you joined me last week and you're coming back, thank you for coming back. I just want to say thank you to everybody for the birthday wishes, for the likes, for the subscriptions, for the shares, for all the support. I actually did not expect to get so much support, and I'm so grateful, I'm so blessed, and I'm so thankful for everybody. So today, I have some of my favorite nurses joining me to talk about what a lot of people actually didn't know was a thing in nursing, or maybe just had no idea that it was this serious or that it happens this often, and that is sexual harassment in nursing. So in this video you'll hear our stories, you'll kind of get a couple tips at the end, but honestly it's kind of what we just went through and what we've been going through. So before we start, we all work at different places, but Sheba and Abby and I do work in one common place, but we also have other jobs as well. Alright guys, time to meet some of my favorite nurses.
Hi, my name is... Oh, I have to look at the freaking camera.
Can we do that again?
Hi, my name is Aldina and I'm a radiation oncology registered nurse.
My name is Abiola and I work in medicine.
My name is Sheba. I work in long-term care.
And you guys know me. So before starting nursing school, did you guys think that there was sexual harassment in the nursing profession? Aldina?
So for me, I didn't know. Well, obviously I will say no, because no one in my family was a nurse, so I didn't know what to expect when I was going into nursing, or that was even an issue, because no one said anything, so I definitely did not expect it.
How about you, Sheba?
I had no thoughts. I honestly didn't even want to be a nurse in the beginning. But because both my sisters are nurses and they told me, oh, it's a really good profession, like you're gonna have fun. Nobody told me about sexual harassment. That is something that I learned by myself.
You're like, it's not something they teach us in school. It's not like you go to school and your chapter is like, oh, this is what happens. Like, it's just something that like you just go into the profession and you see it, you're like, oh, what did I get myself into, type of thing. Like, you're not ready for it, I don't think.
Yeah, for sure. I obviously, like, I don't think it came to my mind. I don't even think like I thought it was a thing until, for me, I'd say like my first experience was during clinicals. I had to put in a catheter. It was like when I was doing the consolidation. I had to put in a catheter for someone. I was all by myself, and you know, like the guy had to take off his pants and everything, and he's like, oh, you take it off for me. I was like,
yeah, your hands work, what?
Exactly. I was like, no, you take down your pants, like I'll turn around, I'll drape you and everything, just like lay on the bed.
Yeah.
So he finally laid on the bed, and then he's like, he left his boxers on, and like he left his thing in there. I was like, you know this procedure, you know what to do, like take it out yourself. He's like, no, I prefer that you do it. I was really confused, and then he finally took it out and I put the catheter inside, and he's like, that's how I like it. I had to leave the room, and I was like, I feel like I don't want to do this anymore. Like, I thought this is like what nursing is like.
I remember my first clinicals was in long-term care, and this old gentleman just walks up to me and goes, well, I see who's gonna give me my shower today. Like, sorry, no English. My English is not good. I'm not from Canada.
How about you, Abby?
Oh, my experience?
Like in school, like, did you have any experiences?
Well, yes. I remember one time I was having my PEDS placement, and then I had this kid.
Whoa.
Yeah, it was a little awkward because I really didn't know what to do because it was a kid, right? Like, I'm like, okay. So he's like, can you put the powder on me? And I'm like, yeah, sure. And I'm like, just like putting the powder all, like he had a brush, right? And powder. And then he's like getting very explicit, and I think he was probably like 12 or 13, so it was really awkward because, you know, like at that time, you know, you think it's like like you don't really think about it. You're just like, okay, this is a kid, like whatever. So that was like, I don't want to go into much details, but I think that was like my first, like, I was like, oh, this is real. This could happen. And it's like, I don't know, like I really didn't know how to react. I was like, oh no, I think the powder is okay where it is. And he's like, are you gonna be my nurse tomorrow? And I was like,
like not.
And I was kind of like, oh, like it was just LOL, like it was like a wake-up call for me, like, okay, this is something that could potentially happen, like from anybody, like not because you know, like their stories, it's more of like older people and you know, when it's from a kid, it's like, oh, like you have to just, I guess, set boundaries. I was just like, yeah, like, you know, this is like I'm your nurse, like we have to be professional and like blah blah blah, but you know, it's the job, it is what it is.
But for me, I think it wasn't necessarily like sexual harassment, but it was like, you know, when one patient gets way too close with you and they start to like rely on you. So for it was in mental health.
Okay.
I had the really like good looking like model, but he was a patient, and the dude, you know, he wanted to slide in my DMs, and I was just like, and he held my hands, and I'm like, okay, you're not gonna have me tomorrow because this is
yeah.
So yeah, like he even cornered me, and I didn't have my page thing, you know, the thing you press.
Yeah.
And then one of the guys was like, dude, you don't ask her for her number now. You do it after. And I was like, oh.
You don't do it at all.
You don't ask her her number. And I'm just like, where's my button? Where's my button? But it was like, I didn't have him the next day.
So working in long-term care, I have come across very many residents that have wanted to do many things with me. One wanted to touch my boobs, and then he was like, hey, like, are you my nurse? I was like, yeah, I am. You have really nice boobs. Can I touch them? I was like, no, you cannot. Oh, I'll pay you $1,000. And then I'm hesitating, and then he ups the price.
God.
She's like, what about 2,000? 5,000? I'll pay you. Please.
So the way that you guys kind of handled it then and handled it now, is it any different? Like now that we're kind of seasoned?
We're seasoned.
We know things.
I feel like I would have handled it very differently, like now that I think about it, like because I really didn't know. I couldn't even tell my instructor because I'm like this is so, it was just so weird. Like I was like,
same,
like you know. But then now I feel like I would have like been like, I'm your nurse, like this is what it is, this is, you know, like you can, I understand, like, you know, we're friends too, we can be friends too, but at the end of the day, like I have to take care of your health first because that's why we're here, you know.
Yeah, for sure.
So I think I would have set more boundaries definitely, like now versus then.
That's a good word.
Yeah. Well, now I'm in a position where I can delegate. So if I ever get the you want to give me my shower, I'm like, you about to get this male PS your shower.
True.
Yeah.
Bon appetit.
Yeah, like it's I feel bad for saying it, but it feels good to be in that position where now I can control.
Yeah.
Like I'm in a little bit of control because before I couldn't. I had to learn how to do all these things as a nurse. But now that I am a nurse, I can be like, okay, someone else can deal with you, not me, not today.
Fair enough. But do we normalize, like especially people with dementia, you know, who aren't really cognitively there? Have we normalized kind of the sexual harassment and abuse that comes from them?
We really have.
Yeah.
We really have.
Yeah.
We keep saying, oh, that's just how he is. That's his baseline. It's like that. And then for me, mine's even worse. I'm just like, oh, he only said it. Like, he never touched me. So it was like harmless.
But even when they do touch us,
and
like, I feel like
touch her, like, but it's
baseline.
It's part of the dementia. He can't help himself.
Exactly.
Yeah.
I've had many patients with their hands on my
on
my bum, and they're just like, and other people are like, oh, he looks great today.
Oh, that's as normal.
Yeah.
Oh, they do that.
Or they go, oh, you know, he likes young girls.
Yep.
It's usually like that whenever he sees a young girl, so it's fine.
Yeah, it's like you should take it as a compliment. The fact that this older gentleman, you know, looks at you and thinks you're beautiful and wants to touch you, you should be like,
thank you. Thanks.
And this is so like different for me because you guys work in a much different
setting
Yeah.
than I do.
Yeah.
I feel like mine, like we have our patients with dementia, but like if they were to cross that line, not only will we like document, but like we'll make
document.
we'll make sure that like it doesn't happen. Like we will verbally speak to you and say what you did was inappropriate. We don't.
But we do that as well. But
They don't understand though. Like
by tomorrow they forgot it.
Yeah.
Like what do you do in that case? Like I feel like our levels of dementia are different.
I think
Like ours, like they eat
Finger foods.
finger foods. They can't remember their last name.
Yeah.
They don't know how old they are.
Yeah.
Okay, yeah. There's levels to it.
So it's
they
like,
can, if you tell them to get up, they don't even understand what you're saying. Like
but all they know is that they want to grab you.
The most recent one was one time, it was after break, and I had a good dinner, and I had like a nice food baby going on. So like I was giving this resident medication. He like pokes my stomach and goes, "What are you having?" And I was like, "A food baby." And then he tells me, "A food baby? Well, do you want to make a real one?"
Oh my god! Okay, so what advice would you guys give to future nurses and nurses who are currently experiencing kind of what we talked about?
I don't know. Like for me, I feel like it starts at the curriculum. So I feel like they should have warned us about this a little, like at least just a little, just touch on it, just just put dip your feet in it. Before you guys started accounting these things in the workplace. But I feel like it starts in school, and then you'll be able to figure it out and work with it in the workplace. But I don't think you can just give advice and it's gonna help, because unless you see it coming or you know it's coming, you're not gonna know how to deal with it.
That's
True.
It's true.
Put that in the curriculum, bro.
If you're gonna work with people with dementia, and it's really bad advice, but I'm sorry, just don't take it personally.
That's hard though.
It's hard because it's the hardest thing to ever do, because sometimes they do be all up in it.
Because when that man, sorry to cut you off, when that man said he was gonna rape me that night, like how do I not take that personally?
Yeah.
Just try not to take. I didn't say don't take. I said try. Just give it your best shot. Just try not to take it personally. It's the disease, I guess.
Yeah, that's true.
It's the disease and not the person. So just try and remember that. You will not always remember that.
Yeah.
Fair.
But try not to.
Just to go off what Sheba and Aldina said, like as much as obviously like don't take it personal, it's the disease. Like that's how some people and like it also has to do like I guess the understanding of the disease helps a lot too, because if you know like, oh, they were maybe sexually repressed as children and then they're like projecting that in their late stages of their lives, like, I just feel like understanding it definitely helps. But also like what Aldina said too, if they teach us in school and they say this is what could happen, this is how you deal with it, and when we come face it, then we're like, okay, at least we're somewhat ready. Whereas in our cases, like for the most part, we weren't even ready for it. Like we didn't know, it's like boom, it's there, happening. And then you're like, oh shit,
it just slaps you in the
teacher. And tips for people in that situation, like we've all kind of said, is like set boundaries. Like you know, like when you see it happening, you have to stop it. At the end of the day, like it's not okay, regardless of what it is, it's not okay. You have to like be like, okay, like this is, you have to set it straight. And I think if you do that, I think I think that's a good way to,
and talk to someone about it too. Don't keep it to yourself when it happens. Talk to someone about it. Like if you have someone at work that you can talk to about what happened, do it. Some people, some nurses, you'll complain to them and they'll be like, well, yeah, that's everything that we've been going through.
Yeah, that's true.
You know? But then just make other friends that are gonna be like, I'm really sorry that happened.
Alright guys, thank you so much for tuning in to Living Life with Your Favorite Nurse. This is just the perspective of female nurses. I hope that we've kind of been able to give you guys kind of a little background about what we go through, and I hope that the advice was useful to maybe future nurses or honestly anyone who goes to work and has to deal with other people. Have a blessed week and bye for now.
And don't forget to comment, like, and subscribe.
My favorite nurses will be back. Trust. Alright guys, thanks so much. See ya.